Hi, I am Nick speaking, and in this video I am going to describe you about diabetic gastroparesis symptoms, treatment and causes. Gastroparesis, a condition also known as delayed gastric emptying, whereby the movement of food from the stomach to the small intestine is extremely slow or stops moving altogether. The vagus nerve, which normally controls the muscles of the stomach, contracts to break up food and moves it through the gastrointestinal (GI) tract. Gastroparesis occurs when the vagus nerve is damaged by illness or injury and the stomach muscles stop working normally. Causes: diabetic people are commonly diagnosed with gastroparesis. People are often diagnosed with idiopathic gastroparesis, whereby the cause cannot be detected even with the help of medical tests. Intestinal surgery and nervous system diseases such as Parkinson's disease or multiple sclerosis may also lead to this condition. Diabetic people have high blood sugar levels that can damage the vagus nerve. Gastroparesis is commonly found in women than in men. The symptoms may relapse over longer period of time. Symptoms: the common symptoms of gastroparesis can be considered as nausea, feeling of fullness after having a small quantity of food, and vomiting undigested food which may go on for several hours after having a meal. Gastroesophageal reflux, GER, also known as acid reflux or acid regurgitation, a condition the food may travel back into the esophagus, may take place. Other associated symptoms may be pain in the stomach, abdominal bloating, lack of appetite, etc. Intake of oily rich foods, fiber-rich foods such as raw fruits and vegetables, or drinking beverages high in fat or carbonation may aggravate the condition. Treatment: erythromycin N-it is an antibiotic which may aid gastric emptying, if prescribed at low doses. Like metoclopramide, erythromycin works by increasing the contractions that travel food through the stomach. Metoclopramide, Reglan, N-this medicine stimulates stomach muscle contractions to help with gastric emptying. This medication should be taken 20 to 30 minutes before meals and at bedtime. Diazepam capsules N-it is a wonderful herbal supplement that can be taken besides medication. Botulinum toxin, a nerve-blocking agent also known as Botox, which when injected into the pylorus keeps it open for longer periods of time, improving symptoms of gastroparesis. Gastric electrical stimulation N-. In this procedure, a gastric neuron stimulator is a surgically implanted battery-operated device that sends mild electrical pulses to the stomach muscles to help control nausea and vomiting. This is an alternative treatment procedure and may be helpful for people whose nausea and vomiting does not improve with dietary changes and medications. Jejunostomy N-. This is an alternative treatment method when medication and dietary changes fail to work and people who are losing weight and frequent hospitalization for dehydration. In this procedure, a feeding tube is surgically placed through the abdominal wall directly into a part of the small intestine called the jejunum. Buy Diazepam capsules from worldwideweb.researchfoundation.com.